Picture this, you're in the car, middle of a road trip, having a good time, and out of nowhere, that pressure hits you. You have to pee, and you have to do it right now. Then you're scanning every exit sign for the next rest stop, wondering if you can even make it to the bathroom. Now imagine that feeling showing up every single night, multiple times for years. It sounds like a nightmare, but that's the reality for millions of men once they hit their 40s. And most of the time, there's one main culprit, an enlarged prostate. What's up everybody? I'm Dr. Jamin Brambach, or Dr. B, as most of you and most of my patients call me. I'm a urologist and robotic surgeon in Orlando, and I've spent my career helping patients with exactly this kind of stuff. Today, I'm walking you through 6 signs that your prostate might be enlarged and what's actually going on inside your body when this happens. And trust me, some of these might actually surprise you. Real quick, let me tell you how this usually goes in my office. The guy usually does not come alone. The guy gets dragged in, usually by his wife. And he always says he's fine and didn't think he had any issues. But his wife is the one waking up at night 2 times, 3 times. Every time he's waking up to pee, she's the one waiting in the car at every rest stop, at every gas station, every restaurant. So she's the one that actually made the appointment. And he showed up, and that's how a lot of these visits actually start. Let's start with some quick context. This is your prostate. It's about half the size of a walnut sitting right below your bladder, wrapped around the urethra, which is the tube that carries urine out of your body. As men age, that walnut can grow thanks to a combination of factors like hormones, family history, and lifestyle. We call this benign prostatic hyperplasia, or BPH. The changes start quietly in your 40s, but symptoms usually show up around age 50. And prostates can grow anywhere from the size of a walnut to the size of a baseball. But here's what most people get wrong. Size doesn't always equal symptoms. I've seen guys with a mildly enlarged prostate who are miserable, and I've seen guys with huge prostates who don't even know they have huge prostates, and they're totally fine. And sometimes I can see exactly why. And how do we usually find these guys where they have big prostates, yet they have no symptoms? Well, this is what usually happens. A guy gets imaging for something else. We find out his prostate is large, and when we take a look inside with the camera, his bladder looked fine. There's no damage at all. But then he has this huge prostate blocking his bladder. The prostate is big, but it isn't really costing him anything. So no, a bigger prostate does not automatically mean you'll have symptoms. But in many cases, a big prostate usually does have symptoms, and if you don't have symptoms today, you probably will have symptoms in the future. So let's get into the 6 signs to actually look for. Sign number 1, a weaker stream. If your stream isn't what it used to be, and now it's like slower, weaker, or takes longer to get going, that's often one of the first things guys notice. Think about it like a garden hose. If you step on a hose, less water comes out and it doesn't shoot out with the same force. That's basically what the prostate is doing to your urethra as it grows. It's squeezing that tube from the inside, and the urine is having to fight through a narrower path. Guys describe it in a different way. Some say it takes longer to get started in the urinals. Some notice that the stream is just not what it used to be. The reach is not as far. Others say it just feels weak, like there's no pressure behind it as he goes. If you've noticed any version of this, your prostate may be the reason the flow is not the way you want it to be. Sign number 2, getting up at night. This is a big one, and it's usually the symptom that actually gets guys into my office because it's the one thing that can affect your quality of life the most. It's called nocturia. And it's when you wake up once, twice, 3 times at night to go to the bathroom. And it's not just annoying in that moment. Every time you wake up at night to pee, you're not getting the restorative sleep that you need. And that catches up with you in the form of fatigue, brain fog, irritability, and even effects on your blood pressure over time. But keep in mind that getting up at night once, twice, 3 times can be totally normal, especially as we get older. As we get older, our sleep cycles change, which may lead us to go into not as deep of a sleep. But you should not assume that because of your age or because of a change in your sleep cycles, this is why you're going through what you're going through. If you're getting up 2 or more times a night, every single night, and it's affecting you the next day, it's worth getting checked out. Remember that wife I told you about that was annoyed and waking up at night and dragging the guy to the appointment? Well, that's the reason she made the appointment, because nocturia doesn't wake up just one person. It can wake up 2. It can wake up the person that's sleeping next to you. And when I am telling the guy in the office, when I first see them, that we can fix this, or at least try to fix this, every single time I see that +1 next to him, look at him and say, listen, I told you so. We just needed to see a urologist. So listen guys, happy wife is a happy life. And that starts with you and her getting a good night's rest. I've actually made a full video on nocturia, where you wake up at night to pee, what causes it, the symptoms to watch for, and what you can do about it. So be sure to check it out.
Nice.
This is probably gonna make me wanna go pee. Sign number 3, going more often during the day. Yeah, not just at night, but during the day too. If you're suddenly the guy who is always looking for a bathroom the second you walk into a restaurant, the second you're about to go see a movie, or you're about to enter this long meeting, if you're having to go every 30 minutes to an hour, and in some cases, you can't even make it through the movie or the meeting without going to the bathroom, well, you have what we call frequency. This is your bladder talking to you. As the prostate squeezes the urethra, your bladder has to work harder to push urine out. Over time, that extra effort can actually make your bladder more sensitive and irritable, so it signals to you, I need to go, even when it's not full. It becomes this vicious cycle. The bladder is more irritated, the bladder gets annoyed, the bladder tells you to go pee, you're going to go pee more, it's empty, but you're still having the sensation that you have to go. I've seen patients who have frequency that we end up finding that it's not just a normal thing. We may find stones in the bladder. We may find little tumors in the bladder. All this stuff is rare, but you won't know until you get yourself checked out. Sign number 4, a sudden urgent need to go. This one is actually different from just needing to go. This is the feeling where there's zero warning. This is what we call urgency. 1 minute you're fine, the next minute you need a bathroom immediately. There's like no negotiation. Bathroom right now. And it's one of the most disruptive symptoms because it doesn't respect your schedule. It can hit in the car, it can hit in a meeting, at the grocery store, it can hit during the climax of a movie. It happens because the bladder muscle is working unpredictably. It has no control. It starts to squeeze whenever it wants, wherever it wants. Sometimes these urges can lead to leakage or dribbling of urine. Now, that can be super embarrassing. Imagine wearing your khaki pants, you have an urge, can't find a bathroom, and boom, you wet your pants. I've heard this story more times than I would like to hear it, which shouldn't be embarrassing. So yes, wetting your pants in public is embarrassing, but what should not be embarrassing is coming to see someone for help. Sign number 5, feeling like you've never fully emptied. So you're done peeing, you zip up, and 30 seconds later, you still feel like there's more in there. That sensation of incomplete emptying is incredibly common with benign prostatic hyperplasia or BPH. Here's why it happens. The blockage from the enlarged prostate can prevent your bladder from fully draining. So there's actually leftover urine sitting in there after you think you're done. Doctors call this a post-void residual. It's not just uncomfortable. Over time, urine sitting in the bladder longer than it should can raise your risk for bladder infections or other problems. Sometimes men are emptying their bladder all the way, but mentally, they may feel like it's not empty. So if you're noticing any of this and it's affecting your quality of life, it's worth getting checked. Sign number 6, straining, starting, and stopping. If you have to push or strain to get things going, or you notice your stream starts, stops, and starts again, instead of flowing steadily, that's your bladder working way harder than it should have to. Normally, your bladder muscle contracts smoothly and your urine flows out in one steady stream. But when there's a blockage, the bladder has to squeeze extra hard, sometimes in like bursts, to force urine past that obstruction. Over months and years, that extra strain can actually change the bladder muscle itself, making it thicker, less efficient, kind of like how any muscle changes when you constantly overwork it, which is exactly why catching this stuff early matters, rather than waiting and waiting and waiting until maybe it may be too late. So let's talk about why guys wait. Because they wait years, not months, years. We actually ran a survey through Orlando Health, and this is what we found in the survey. We asked 1,000 guys, what are your top excuses for not going to see a doctor? Here's what we found. Most guys said they have no time. The second most top excuse was they were worried about the physical exam. And the third most common excuse was they were afraid of what we would find or what we would tell them during the visit. Now, I've heard every one of these in my office, but here's what I actually think is going on. Those aren't really three different excuses. They're just one thing wearing three different costumes. And what it actually is it's fear. And here's the part I want to say directly to the guys watching this. When somebody finally sits down in my room after years of doing this, and after years of overthinking this, I'm not gonna get upset. Your wife or your loved one has probably already gotten mad at you, and I'm not here to add to it. What I say, and what I will say, and what I hope the doctor that you see will say is, listen, you're here now, let's see what we can do for you. Now, before we get to what to do about all this, quick word on when this stops being a wait and see situation. If you cannot pee at all and your bladder feels painfully full, go to the emergency room. That's urinary retention, and it needs to be relieved that day to protect your bladder and your kidneys. If you see blood in your urine, get it checked. It can absolutely come from an enlarged prostate, but it can also come from things you don't want to sit on. And if you got a fever along with burning and urgency, that could be an infection. That needs to get treated now, not next day or next week or next month. Okay, now let's get back to what we do when things are not emergencies and we have time to do a workup. So how do I know how big your prostate is? There's a few ways. I can estimate it based on an exam, what we call a digital rectal exam. I can get a measurement with an ultrasound, what we call a prostate ultrasound. But the one I like the most is something called a cystoscopy. It's where we take a little camera and put it inside your urethra and see what your prostate and bladder and urine channel look like on the inside. And most people think this needs to be done with you asleep in the operating room. It doesn't. I actually do this procedure in the office with you awake. Yes, you're awake. Trust me, guys, it's really not that bad. Now, a cystoscopy doesn't really help me measure the exact size of the prostate, but it can help me figure out what's affecting what on the inside. And here's my favorite part about a cystoscopy. There's a screen and the patient is watching it with me in real time. You get to see your own prostate, your own bladder, and you get to see what I'm seeing, and we get to learn together what could be causing your problems. Now, sometimes when I get in there, everything is wide open. The channel's open, the channel's clear. I can see straight into the bladder, no problems. But in most guys that I see in my office that have symptoms, I see a prostate that's grown into the channel from both sides. The two lobes are practically kissing each other in the middle. And I'll tell my guys this, look, your prostate has love handles. Because it does, because it's ran out of space on the sides and now it's started to grow into your bladder. Those are real, true love handles from your prostate. Now, if the growth doesn't happen on the sides, but happens from the middle, this is what we call a median lobe. This is where a ball of prostate from the center of your prostate is extending into the bladder. I tell my patients, their prostate in this case has a dad bod. Yes, your prostate can have love handles and a dad bod. But here's what I'm actually looking at. And this is the part most people never hear. It's really not your prostate, it's your bladder. Because a bladder that's been fighting a blockage for years starts to change. It gets thick, it gets irritable, it builds up those little pouches, which we call diverticuli. And I can see all that on the screen when we do your cystoscopy. So when I'm doing a cystoscopy, asks me, hey doc, how's my prostate? I usually tell them, it's not the prostate that I'm really worried about, it's actually everything around it and what it's doing to your bladder. Beyond the imaging or the cystoscopy, we actually will start off by asking you questions. We'll ask you about, are you waking up at night to pee? Do you have frequency? Do you have urgency? Can you make it to the bathroom? Are you having issues with leakage? We'll actually do a full, thorough evaluation by just asking you questions. We actually need that full history. And then we add on the physical exam and then imaging or cystoscopies to get a full idea of what's going on inside so that we can personalize treatment for you. Now, when it comes to helping you, you've got tons of options. And to be honest with you, most guys don't need any major kind of surgery. For men who have no symptoms or very minor symptoms and want to be proactive with their prostate health and want to go for something more natural, we may recommend a high-quality saw palmetto supplement. For all guys, the initial step also includes behavior changes. Drinking too much coffee, not drinking enough water, drinking tea right before you go to bed, are you constipated? All behaviors we may recommend that we try to adjust. Now, if behavior changes don't work, we may recommend medication. Alpha blockers relax the muscles around the prostate for quick relief. Tadalafil, the same pill used for erections, can be used at a low daily dose to also help relax the prostate to improve urinary symptoms. And finally, there are medications that can actually shrink the prostate over time. If pills aren't enough, there's a range of procedures that we can do that are minimally invasive, same-day outpatient procedures where we can get you urinating better. Now, these procedures can be minimally invasive or maximally invasive, but the focus is always getting you peeing better, protecting your bladder, protecting your kidneys, avoiding infections, and at the same time, minimizing risk from these procedures. The biggest risks that guys care about is erectile dysfunction, issues with your ejaculation, and potentially having dribbling and leakage after the procedure. So what are some of the minimally invasive options for enlarged prostate? The two most common minimally invasive options for enlarged prostate that have minimal risks to sexual function, minimal risk to ejaculation include Resume, which is steaming the prostate, and Urolift, where the prostate is lifted with implants. Now, there's other procedures that are a little bit more invasive, but they're still minimally invasive in my opinion. This is where we are doing these procedures through a camera and instruments through the penis, so there's actually no cuts on your body. So to open up your prostate, we can open up your prostate in other ways. We can do the gold standard, something that's been done longer than I've been a urologist, which is a transurethral resection of the prostate. That is actually where we go inside your urethra and we have an instrument with a loop that can start cutting your prostate on the inside using energy. This procedure can take anywhere from 30 minutes to 1 hour. Most patients go home the same day. They may go home with the tube inside the bladder, and this is meant to help with healing and bleeding. That tube usually comes out 5 days later. Now, that is just one option in how to open the prostate up on the inside. There's other ways to do it. We can actually use a laser. This procedure is called holmium laser enucleation of the prostate, or HOLAP. This is where we actually use a laser to carve out the inside of the prostate. Those love handles I talked about, we can actually take a laser and carve out those love handles and other parts of your prostate to open up that channel. There's also a robotic procedure, a procedure called a simple prostatectomy. That is where small keyhole openings are made in your belly and a robot is put inside your prostate and your prostate is removed from the inside of your belly. Now, this is not the same procedure as a total prostatectomy that is done for cancer. In this specific procedure, the parts of your prostate that are enlarged are actually removed. So there's parts of your prostate that are still left in, but those enlarged areas are removed through a robot, through your belly, and this is called a simple prostatectomy. Now, there's also a newer procedure called aquablation, where a robot maps out your prostate and a high pressure water jet removes tissue with no heat at all. There's even an option where we go in through your arteries and cut off the blood supply to your prostate to help shrink the prostate. So these are just some of the procedures to open up your channel. Now, let me be completely upfront about something. I don't perform all these procedures. What is done or recommended for you should be personalized to you and your needs. Because here's the thing about an enlarged prostate. There's no single best procedure. There's a best procedure for your prostate, your size, your anatomy, your symptoms, and what matters most to you. Every procedure for the prostate, even if it's minimally invasive, can carry some risks. Now let's talk about the question I get asked more than any other. What's gonna happen to my erections and what's gonna happen to my ejaculation? Your erections, usually fine. For most of these procedures, erection function doesn't change much. And if it dips right after, it typically comes back. Depending on the procedure, the overall risk can be 0 to 5%. Some of this also comes down to the surgeon and their experience. Ejaculation is a completely different conversation. With a prostate resection, depending on which study you look at, somewhere between half and 3/4 of men will have what we call retrograde ejaculation. That means the semen goes backwards into your bladder when you're ejaculating instead of coming out. Now, you still will have an orgasm. It still feels the way it's supposed to. There's just no juice coming out. And your urine later on may look a little cloudy because that's where the ejaculate comes out of. You actually pee it out later on. Now, in a lot of cases, this change is permanent. Now, I've seen where this can come back, but in most cases it can be permanent. So I just want you to know, like, if you do have retrograde ejaculation after these procedures, there's really no long-term risk to you. So unless if you're planning on having kids, this really is not an issue for most men. So before we wrap up on this topic, I want you to remember that an enlarged prostate is not prostate cancer, and it doesn't turn into prostate cancer, but it can make screening a little bit trickier to interpret, which is exactly why regular checkups matter, not just for these symptoms, but for staying ahead of anything else that could be going on inside of you. So don't put this stuff off. The earlier we look, the more we can prevent. And I want to be honest with you about what we're preventing. A bladder that fights a blockage long enough can stop squeezing altogether. And when that happens, it doesn't always come back. That means a catheter to empty it, possibly for good. Now that's the extreme end. Most guys never get there, but I've seen it. And every single time, it started off as something small that some guy just kept putting off. So if you're the guy in this video, go make an appointment. Don't wait for somebody to make it for you. And if you're the wife who's been up at 2 or 3 in the morning for the last few years, send this video to your guy. Maybe it'll inspire him to come and see us. Thank you so much for watching till the end. If you got something out of this video, please hit that subscribe button, hit the bell so you don't miss the next one, and drop a comment below. How many of these 6 signs or symptoms sound like you've had them? Would love to hear from you guys. And if you're interested in preventing health problems before they even start, check out my video on the 5 most common reasons men see a urologist, where I break down the issues I see most often in my clinic and the steps you can take to protect your health early. This is Dr. B. Thank you so much for watching, and I'll see you in the next video.